The day my beautiful and loving wife of 4 years said she is leaving me, my life changed from what I had supposed it would be.
BJ, you're not saying anything.
About what?
About us seeking for help. To at least...
Moji, please. Not tonight. I have a headache.
Mr. Mobolaji Ogungbe, why do you always do this? Each time I raise up this issue, you brush me off like I'm talking rubbish.
I don't know whether the problem is that you're deaf or what. There you go again. Continue.
Oh, this does not bother you at all, does it?
No! And it should not bother you too.
Bolaji, 4 years. 1, 2, 3, 4 years. You're the only man I've been with. Now look at me. 4 years after saying I do with a flat tummy, you could practically set a clock by my periods.
I don't know what the big deal is with you. I just don't know, Moji. A lot of couples have waited longer to have children.
Bolaji, it is easy for you to say. It is easy for you to say because you're not the one who everyone asks if there's a bone in the oven yet. Or worse still, the look of pity when you say no. When they laugh at our back, they practically call me a man. BJ, you think I don't see how your mom and sisters look at me?
Well, if you're so bothered about how they look at you or what they say, then maybe you should check yourself.
What do you mean by that? Bolaji, what
Would
do
you
you
leave
mean
me
by that?
alone? Look, my darling wife, if something is wrong, maybe it's with you. Leave me alone, please.
Bolaji, I don't believe you're saying this.
Would you shut up your mouth? Good night.
Caught up in another dream, drifting on a blue ocean. When you gonna reach out, only you can turn your world around.
I'm going back to my father's house.
What did you just say?
Since you have stubbornly refused us to seek medical help and heaped the blames on me, I don't think I'm of any use here. I'll pick a few of my things and over the weekend I'll get a car to pack my remaining stuff.
Moji, are you sure you woke up with your senses this morning?
If you say it's my fault, then you really don't know me.
Why would you make such an issue out of this? What do you want me to say? What?
PJ, I asked you. I begged you. Countless times. Let's go see someone. Just to make sure we're okay. But no. No! Today it is God's will. Tomorrow you are busy. And recently, we are not the only couples. Seriously?
Moji, I have done everything to make you happy. Made love at odd hours and with certain timetables, you know. I have to bathe with cold water even when it's cold. I've had to eat in weird stuff. You are laughing. As if it's not demeaning enough. You want me to go see a specialist. No way, Moji. No way.
So this is what this is about. Your ego. Oh, you don't want people to know there is something wrong with the firehouse? People shouldn't know why I am not pregnant. Mr. Ogungbe, if you want this to work, you know where to find me. Excuse me.
Moji. Hello. Good morning, sir. Yes, sir, it's me, Bolaji. Yes, there's an issue here. Now, yes, if you can come now, sir. Thank you, sir. Yes, yes, she's here. Thank you. Moji!
Uncle Steve, all I am asking is for us to see a specialist. To at least give us a clean record.
And I have told you that nothing is wrong with me. Absolutely nothing. I don't know about you. I mean, do you know how many times I have been congratulated for my prowess before I met you?
Mr. Eshi, your repetition precedes you.
Uncle Steve, you see what I'm talking about? You see what I am saying? Moji keeps implying that I'm not a man, mocking me day and night.
Bolaji, did I say that? Did I say that? Uncle, look at him putting words into my mouth.
No, you manufactured them.
Hey. Enough. Is this all what this is about? What both of you should have done after trying for over 1 year after your wedding without positive result, you should have gone to a clinic so that you could be checked to know what and if there is problem.
Better warn yourself.
Bolaji, will you shut up? And now, there might be nothing. And if even there is something, it might not be the fault of any of you.
Tell him, oh, tell him.
You see her again. Uncle, you see her again. I will not have Moji feel like she's the one that makes the decision in this house.
Bolaji, sit down. I say sit down. Moji, my dear wife, I rushed down here this morning because of this matter. I couldn't wait at home to take my breakfast.
I'm sorry, sir.
You see yourself. Madam, know it all.
Uncle, please. The noodles we have just finished last night. Let me go across the road and get us some.
Okay, go and do that
Okay.
quick. Now, Bolaji, between me and you, I have something to tell you.
Uncle, what is it?
First and foremost, in the interest of peace, you have to go with your wife to see a specialist.
Okay, no.
To satisfy her. I am telling you this from experience. I had similar problem. And just like you, my ego did not allow me. But at the end of the day, it was discovered that I had low sperm count.
Low sperm count.
Yes.
But you have 4 children.
Of course I have. We kept it to ourselves. But because we are able to discover it early enough, we did something to it. You will be introduced to a group that has similar problem with you so that you can cope. So, I am advising you to go and see a specialist. But pray it isn't you.
Then I am finished in this house. Moji will never let me hear the end of it.
Don't worry about that. I will take care of that.
But Uncle, I have never had any sexual health issues. Never.
Uncle, I got some, even with some eggs. How many will you eat?
2 is okay for me. But if you can make 5, I will share it with Bolaji.
Okay, sir.
Come, Moji. Don't go yet. Come and sit down. Let us finish this. I have good news for you. Your husband has agreed to go to the hospital with you. Abi, Bolaji. Bolaji. Abi.
Yes.
Now, whatever the situation turns out to be, I want both of you to keep it in mind how sensitive this issue is and not to hurt each other's feelings. And if it turns out that either or both of you have problems, it is your duty to support the other fellow. And do not hurt each other's feelings, because the mental and emotional strain can worsen the situation and probably break your home. God forbid, we don't want that. Do you understand me?
Yes, sir.
Now, Moji, take that bag and go inside. This is your home, and you must keep your home.
Thank you, sir.
It's all right. My beautiful wife, God bless you. Bolaji.
Sir. Thank you, sir.
I hope you are okay now.
Thank you.
So that's how we went to the hospital and we were referred to this fertility clinic, where they ran a number of tests on Moji and myself. It turns out Moji was clean, and I was diagnosed with low sperm count. You can imagine how I felt. The doctor said it was like going to war with the gun loaded. Only problem was that I was shooting blanks. I was hitting the target quite alright, but there was no lead to make any impact. Can you imagine? Me, BJ, no impact. So we agreed to do the IVF, and as if it wasn't demeaning enough, as if it wasn't bad enough, on the day I was to produce samples, yes, the day of treatment, there was no sperm in the sample. It was as if the whole world had a meeting on how they were going to disgrace me. My situation had gone from bad to worse. No, I'm fine now. Moji was an absolute darling. She was by me the whole time. She is my pillar. And that was almost a year ago. Now my beautiful wife and I are soon going to be proud parents of a bouncing baby boy. Yes, of course, I'm going to be a father.
Good to have you join us again on another edition of Beautiful Beginnings. This is the forum where experts allay fears. They also demystify known notions, be it facts, be it fallacy. And joining me today is Dr. Abayomi Ajayi to talk about male infertility. You're welcome to the program.
Thank you very much.
Naturally, we wonder, what is male infertility?
Well, simply put, male infertility is when the man is responsible for infertility in the relationship. In other words, when a man cannot impregnate his wife, simply put. And the thing is that this is a very common thing, and it's actually getting much more common than what we thought it was 30 years ago. Sperm count seems to be reducing all over the world, and we don't know the reason why, but that is what we're living with now, that the sperm count appears to be reducing considerably.
Well, now you're saying that there must be some estimated figures. What is the percentage of this problem?
Well, what we see now is that male factor infertility contributes equally to the proportion of infertility as the female. So we put about 30 to 40% on it. But also we look at the fact that when it comes to combined factors, the men also still contribute equally to this. So about 40 to 50% of infertility are due to the man.
Naturally, what are the causes?
Well, for a very long time, the emphasis was placed on that people were born that way. That, okay, you inherited low sperm count from one parent or the other. But we know that that might not be totally true. Because now what we're looking at is that the environment, there is a lot of factors in the environment that might be reducing sperm count. Of course, in this environment, the first thing to talk about will be infection. Okay, sexually transmissible infection, either not properly treated or not treated at all. Now, we look at again the effect of injuries, or what we call trauma, to the testes. Either when you were playing football, you had an injury, or you fell into a manhole, or something like that. Then we look at lifestyle. We know that obesity contributes to low sperm count. We know that alcohol contributes to low sperm count. We know that use of tobacco contributes to low sperm count. Of course, hard drugs, marijuana, cocaine, everything depresses sperm count. And then we look at people using anabolic steroids these days that they're talking about six-pack or whatever. A lot of it affects the sperm count. Then, of course, some antibiotics, and that's why we talk about people not taking drugs that were not prescribed to them. There's some antibiotics that can lower sperm count. And, of course, some other drugs also, prescription drugs, can lower sperm count. And some form of vocation can lower sperm count. For example, there was a wonderful study done in France where it was shown that people who work in gas stations might have reduced sperm count over a long period of time. We know also that people where, for example, long distance truck drivers, that the testes are exposed to high temperature over a prolonged period of time, the sperm count might be affected. And of course, again, low sperm count might be a reflection of a tumor growing in the testes. So these are the things that can lead to low sperm count.
Well, now, you've been a fertility expert. How do you diagnose this?
Until we actually examine the sample in the laboratory, nobody can say that a man has male factor. So we have to collect the sperm sample, we have to examine it in the laboratory and come up, because there's some things that we look at in a sperm sample.
I mean, you will agree with me that oftentimes the accusing finger is pointed to the woman. And looking at the skids, it turned around to be the man's problem. Now, what are the available treatments?
Well, the treatment for male factor infertility can still be divided into three. We talk about drugs, we talk about surgery, and we talk about ART, or assisted conception. Now, when we talk about drugs, there are not many conditions that the male can have that are amenable to drugs. Let me put it categorically and say that there is no sperm booster as we speak, okay? So, but there's some conditions in which some drugs can be helpful, especially when you have problems with the hormones. But the main way to treat male factor infertility is ICSI, or intracytoplasmic sperm injection. The word, the big name just means that you take one sperm, technologically we can recognize one sperm and inject it into one egg, just like we're going to be seeing on the screen. From about 2004, we moved on from that to what we call IMSI.
What does that stand for?
Well, IMSI means intracytoplasmic morphologically selected sperm injection. What that means
Big name.
Yeah. What that means simply is that we use the morphology or the structure, the shape of the sperm to pick the ones that are normal and then use them for ICSI. In other words, what we do is that we magnify the sperm to about over 6,000 times 6,000, and we're able to see the different parts of the sperm, the head, the neck, and the tail, and we choose the ones that look normal to fertilize the sperm. And also, what we're talking about now is actually, we're talking also about PICSI, which is physiological ICSI. What this means is that we try to choose the sperm. We have been able to identify the protein that is around the egg, okay? And we've seen that it is only the normal egg in nature, the normal sperm in nature, that can fertilize the egg, okay? So we've seen that there is a receptor now that is attracted by the protein that is covering the egg. So we've been able to identify that protein, and now we put it on the dish, and then we now put a sperm sample in that dish, and we look at the sperm cells that have affinity for that protein. And those are the ones that we now use to do ICSI.
Yeah, I'm going to take you back a little to the skits again. Bolaji said no sperm on treatment day.
That's right.
I mean, how is that handled?
Well, we sometimes get to that where either the man is even not able to produce sperm on that day because of the lot of stress and anxiety involved, or sometimes you get the sample and there's no sperm cell. And what we normally do is to go to the testes. There is a procedure that we usually call TISA, testicular extraction or sperm aspirate, but it simply means that just going to the testes, because we know the testis is like the factory where the sperm is made. So if you go to the testis, there is a small procedure, just put a needle, there's a small needle that we can put there and actually extract the sperm.
Very well, Doctor. I know we have other segments to talk about on male infertility. For our viewers, we are going to take a quick break. When we come back, we will have more experts to shed light on male infertility. Don't go anywhere.
You know, some people go dey talk say now for your ear only. Sure, you don't buy your own because me I don't buy my own. You know, say everybody must. Sure, you know that our friend will they talk about. Because when he reach, they go say they talk too much. Not beside they talk. Oh, why not go leave the girl? Why not go leave her? Tell them say na me tell you. You hear all that yeah one. You see as I they talk to you plenty now because I get glow too. That make me they talk. All right, make we talk about the party we won't go. Thank you, my sister. You do well, eh? We go see for that place. I be not be so. All right. You say I won't talk plenty. Una no self say I no dey lie. You see this glow? If you get am, una no go even una go just dey talk dey go because the thing not there. E cheap and as everything go clear well. Excuse me. Hello? Who be that? Oh, now you eh? All right.
PJ, I asked you. I begged you countless times. Let's go see someone. Just to make sure we're okay. But no. No! Today it is God's will. Tomorrow you are busy. And recently, we are not the only couples. Seriously?
Moji, I have done everything to make you happy. Made love at odd hours and with certain timetables, you know. I have to bathe with cold water even when it's cold. I've had to eat weird stuff. You're laughing. As if it's not demeaning enough. You want me to go see a specialist. No way, Moji. No way.
So this is what this is about. Your ego. Oh, you don't want people to know there is something wrong with the firehouse?
You're still watching Beautiful Beginnings, and joining me on the program this time around is Tola Ajayi, a fertility counselor, who is going to be talking more on the counseling aspect of male infertility. The issue that came up was ego, not a man's problem. That is usually the case, and that delays treatment. Tell us about that.
Unfortunately, in this part of the world, men are usually not infertile. The blame is usually on the woman, either from the couple, from the society, from everybody.
How should we handle ego when it comes to male infertility?
Oh, well, to a large extent, I think education is the key thing. When the man understands the problem and he understands that no one is putting blame on anybody here, it's just for us to do what is right and also to help them to achieve their aim. So when is well informed about the situation, I think they usually get over it.
There was a savior in that skit called Uncle Steve. And we saw that he's had his own experience from infertility. My question is, how can we produce more of Uncle Steve?
We need to have many Uncle Steves in our society. And this can only come up with people coming in support groups. You know, there's IVF and U program where people can come and learn more about their challenge. And once you're able to go through it, you can also counsel other people, you know, to let them know that I've been through this situation and this is the way I was able to cope. So it's very important for people to come together in a support group and learn how to deal with their issues.
But we know that sometimes, no matter what you do, you still don't have sperm.
Yeah.
And you have to resort to use of donor sperms. What are the problems that arise from use of donor sperms?
When people are to use donor sperm, it is a major thing for them to come to terms with, So you really need to talk to them about the implication. You know, a lot of support needs to be given at this time. People usually don't accept the use of donor sperm because the man will feel like, oh, I'm not a man. I'm not a complete man by the time I'm using donor sperm. And a lot of counseling on both of them, the man and the woman, is very important. I've had a series of, times when, sometimes when people will come back to say the man is not accepting the baby, I've only allowed you to share my name with the baby, for the baby to share my name, and things like that. And these are people who have gone through counseling, you know, to know what they're going through and all that. It's a major challenge. It is a major challenge.
What can a woman do when the husband doesn't actually accept the baby?
Well, they still need to go through counseling. Support counseling can never stop in such situation.
Okay. Thank you so much, Mrs. Ajayi, for joining us on Beautiful Beginnings. We'll be right back. Don't go anywhere. Welcome back. And in the house is Dr. Funmi Biobako, who is going to work on frequently asked questions. You're welcome, Doctor.
Thank you, ma'am.
Well, now, normal sperm parameters, what's that?
According to World Health Organization, normal sperm parameter refers to sperm count of more than 15 to 20 million per mil. Motility in terms of ability of the sperm to move, at least should be more than 40%. And morphology, that is the normal shape of the sperm, at least should be more than 40%. That is what is referred to as normal sperm parameter. Any deviation from this is referred to as abnormal sperm parameter.
Now, impotence versus infertility.
The word impotent, it means that inability to attain or sustain erection, whereas infertility refers to inability of a couple to achieve conception after adequate unprotected sexual intercourse. For a man to be infertile, for a man to be referred to as being impotent does not mean that that man is infertile. As long as we can get good sperm from the ejaculate or through the process of what we call testicular sperm aspiration, we can still use that sperm to fertilize the egg.
I'm sure doctor has a question for you.
Oh yes, there is this new thing. I mean, one of the mails we received that some people are coming up with this, what we call DNA fragmentation. What is this DNA? What is all this DNA fragmentation all about, and how can it be treated? Or
as we all know, that sperms need so much energy to get its motility. Through that process, it generates what we call oxidation, and this oxidation damages the sperm cell membrane and the DNA. So in that process, there is damage to the powerhouse called the mitochondria in the sperm cell, and that leads to what we call DNA fragmentation. So this has become so much of a news that people want to correct the abnormality. But what one can do is to prevent the oxidation process. And one can do this by counseling, educating people from taking drugs, medication that are not prescribed, that is what we call substance abuse. Also to counsel them against smoking, excessive consumption of alcohol, and also some people, some men find it more convenient to put their laptops on their laps, and through that process there is release of radiation that can damage those sperm cells. So through this education we can prevent DNA fragmentation.
The varicocele,
Yes.
what are they?
That's good. Thank you, sir, for using that.
What are they, and how can it be treated?
Varicocele are dilated veins in the scrotum, and this dilated vein results from improper drainage of blood from the scrotum. This can increase the scrotal temperature and thereby have impact on sperm production and the motility of sperm. Some surgeons tend to want to correct the abnormality by performing what we call varicocele. If this is done, there is this aftermath effect of the inflammatory process that takes place after the surgery that can cause damage of those sperm tissue. This can further lead to abnormality of sperm production and also affect the motility of sperm. So we tend to counsel clients that it's better for them to go through the process of IVF. As long as we can get good sperm from the sperm cell and from the scrotum, we can use that for IVF process, and they can achieve their desired results.
This topic is by no means exhaustive, but I want to thank Dr. Abayomi Ajayi for joining us on the program this week. Thank you very much for coming.
You're welcome.
And Dr. Fumi Biobaku as well. Thank you very much. I hope if I call you next week, you will join me again.
Yeah.
Very good. Thank you so much. And that's where we leave it this week. I am Shiju Alabi, and I'll see you next week.